assessment, I'm going to make an appointment for you to see our nurse practitioner later on today.
Okay.
And when you talk to him, I need for you to be just as open and honest with him as you have been with me, so that we can determine the best way that we can help you.
Okay.
Okay.
That sounds like a plan.
All right, well, thanks. I've enjoyed it.
All right, thank you.
If you suspect the presence of a brain injury after completing the HELPS, confer with the client about the possibility that the brain injury and current problems or symptoms are linked. Document reasons for suspecting a TBI in your client's file, and begin to implement the strategies outlined in this training to address cognitive and behavioral deficits that may impact treatment. Consider referring your client to a physician or primary care provider for further assessment. Such a provider may use a neuropsychological assessment or medical records to confirm a diagnosis. General consequences of a TBI can be categorized into the following areas: physical changes, cognitive changes, behavioral and emotional changes. Physical changes caused by brain injury may be more visible than cognitive and behavioral changes. In fact, cognitive and behavioral changes can easily be overlooked once the physical injuries have healed. In regards to substance abuse treatment, the cognitive and behavioral changes most often impact the individual's success at achieving sobriety. The video clips presented in this training will focus primarily on the cognitive and behavioral changes after TBI. Please note that for educational purposes, the survivors in the following video clips self-identify. Your clients may or may not openly disclose their brain injury. The counselor should encourage this communication in the group setting. Cognitive changes after a TBI include memory impairment, attention deficits, challenges expressing and comprehending language, and alterations in executive functioning. Memory is an important part of substance abuse treatment. Clients must remember their appointment times, their counselor's name, their group members' names, the goals of treatment, and the rules in a group setting. The list goes on and on. However, if memory impairment is present, simply recalling the date and time of appointments may be impossible, hindering the client from taking the important first step in recovery, showing up for treatment. It is important for substance abuse counselors to recognize that missed appointments on the part of the brain injury survivor may not be the result of lack of motivation to seek treatment, but rather are a consequence of the brain injury. The counselor should make attempts to help the client overcome memory impairment.
All right, now we just finished hearing the lecture about the fact that addiction is a disease. And I know a lot of times when you're early in treatment, people have question about that because that's not necessarily how society looks at addiction. And so what do y'all think about that? Do you agree with that?
I honestly don't really buy it. I know a lot of people who drink and they stop when they want to stop, and I think it's just a lot of very weak people who
Hey, excuse
can't
me, I'm
handle
so
their.
sorry.
Hey,
How y'all
Louis,
doing?
how are you?
And everything. Oh yeah, 1 second. I saw your cousin in the store. He said he's gonna give you a call
No.
later on. Yeah, so.
Saw him?
Yeah, so I'm sorry
Okay.
about this. See, get me
That's
situated right quick. Let's see here.
Okay.
Let's see.
Okay, so where were we? The disease of addiction. It is a disease, and it's treated like a disease because it changes the brain, just like heart disease, just like high blood pressure. You know, there are changes in the brain that occur for people who become addicted. And there is a behavioral component to it. You're right, people have to stop their drinking or their drug use. But that's what treatment's all about, is we're gonna teach you about how to stop drinking.
I'm sorry, I have a question. Why does he get to come in late?
You wanna answer that for her?
Well, I'm sorry about being late. It's kind of hard for me to keep up with the times and stuff because I had a brain injury some time ago, and so it's really hard. And that's why Actually, my mom was the one to actually remind me that I have a meeting and stuff like that. So I'm really sorry about that. And hopefully, I'm trying to get a little bit better. But you know, with brain injuries, it's kind of like it's a stepping stool. That it's just certain things. Is one of the major things that we have to go through is keeping up with time. It's just hard, and I apologize to everybody though.
Thank you, Larry.
Thanks.
And, I think that it's important for you to understand that everybody in this group, brings things to it. It's all different, and they all manifest themselves differently, and we have to accept each other for where everybody is. And so I'll be working with Larique about this, and hopefully, we can deal with it. But there may be some accommodations that I would make for each and every one of you. Because the important thing to me is that you get this treatment and you get into recovery. It's a one day at a time deal, ladies and gentlemen. All right, well, I think it's been a good group today. I think we've processed a lot. I want you to think about this whole thing about disease and addiction being a disease and your thoughts about that. I think we have covered a lot of it, but if you have more questions, we'll talk about that next time we meet. And we're going to be talking about the medical consequences of your drinking and drug use at our next session. So I'm glad everyone was here. It's a good group. You did a good job. And I'll see you tomorrow, okay? And Larique, if you'll just stay a couple minutes and then talk to you, okay?
Oh yeah.
There are several techniques that can be used to assist clients with overcoming memory deficits. Simply using a planner to track the date and time of appointments can be very useful. Encourage the client to bring a planner with him to your meetings, schedule several appointments in advance, and assist the client in recording these times in his planner. You may additionally want to call or email your client before a scheduled meeting. Remember not to assume that missed appointments are related to motivation for treatment. It may also be important to address the transportation needs of the client, since driving or utilizing the executive functioning and planning skills needed to follow a bus schedule may be impossible after a brain injury. When the same memory deficits that can lead to missed appointments are combined with diminished executive reasoning ability after a brain injury, learning new information can be challenging. When presenting new information to a TBI survivor, limit teaching to one topic at a time, use a handout to help the survivor recall the most salient points of the lesson, and repeat when necessary.
The reason I asked you to stay after is I wanted to talk with you about, I know you were late today,
Yeah.
and so how is it that I might be able to help you be on time? What about remembering to be here on Monday, Wednesday, and Friday? Is that a problem for you, or?
Yeah, it's just like usually rely on my parents and
Okay.
then just tell them and just if they remind me or leave it on the table, like a
Okay.
note on the table and
Okay.
everything. They weren't at home
Okay.
today, so.
Oh, okay. Well, one of the things actually that I use to make sure I remember my meetings and my groups and whatnot
Right.
is I use a planner where I write down my appointments so that I can look at it. I can look at it the day before and go, oh, I've got that 9 o'clock appointment tomorrow. Have you ever used a planner? Do you think that might be helpful?
I never used it. I mean, I guess anything could help. I just wouldn't even know how to start. I mean,
Okay. Well,
it
maybe.
was kind of confusing. a
Well,
little bit.
let's just look, here's March, and this is today, today's the 2nd. And so you would be having group on Monday, Wednesday, and Friday.
Right.
So I'm wondering if for Friday, if I write in here for you 9 o'clock group, that would help you remember, since I won't see you tomorrow, that
Right.
you could look at, you would have a time that you would look at this, that you would maybe sit it on the kitchen table so you would see it, and that you would look and go, that's right, I've got group, I gotta make sure I called special transportation to pick me up. Probably, what time did you tell them today to pick you up?
Oh, it took about 35 minutes to pick me up.
Okay.
But it posted only took like 15.
Okay,
So-
yeah, I think you should at least have them pick you up an hour before, so I think 8 o'clock, and that
Yeah.
hopefully will ensure that you can be here by 9 o'clock. And
Right.
again, if you get here early, then you can just hang out, have coffee, and,
Right.
chat with some of the other clients.
That makes sense.
Does that sound like that would work?
Yeah.
So I'm gonna put 9 o'clock, I'll put 9 o'clock in here.
Okay.
And then I think what would be good then is, so that I'm not, overloading you and giving you too much information, it's maybe every Friday. So come this Friday, I'll write out for you the days and the times for next week. And we'll do that every Friday. So when group's over on Friday, you'll stay behind and we'll just spend a little time doing this. or-
Like today.
Yeah, exactly.
Okay.
And then you can come to my office and we can talk about that and see if that's working for you. Now, the other thing that we talked about was, remember we talked about you bringing a pad of paper and a pen to group, or I said I would bring that for
Mhm.
you. Maybe what would be helpful for you is to bring your planner and have a pad of paper in there. So as you have thoughts, whether it's in group or at other times about your recovery and what it's like not to be drinking and drugging, you could go ahead and jot those down and always have that with you and bring that with you to group.
I know, but sometimes I get kind of sidetracked that I may forget to write stuff down
Okay.
when the meeting's going on. So would you kind of help me maybe at the end of each meeting, like today, we go back and like recap
Yeah,
a lot of
we could
stuff
do that.
or anything
Yeah.
I need to write down?
Right, we can talk about what the themes were and
Yes.
whatnot. And then sometimes I give out a handout in group, sometimes I don't, it depends on what we're talking about. So, would it be helpful for you to have a handout? Would that help with your learning? If I have something in writing for you to look at, not only during the group, but when you leave, would that be helpful?
Oh, yeah, that'd be very helpful.
Okay, and then that's the other thing we can review at the end of the group is,
Right.
Any questions you have about that, like, what did you mean about powerlessness? I don't know exactly what you meant about that.
Yeah.
Would that work?
Yes.
Okay,
Many brain injury survivors experience behavior changes after injury. Sometimes a lack of self-awareness can lead to an inability to control emotions, social inappropriateness, and missed social cues. The survivor may not know he is repeatedly interrupting during group discussion and may also be unaware that certain comments are offensive or hurtful. In addition, changes in brain chemistry and physical ability can lead to increased frustration, anxiety, and irritability. Some individuals who have sustained a TBI may lose their temper easily or become frustrated over things that others find trivial. To overcome behavior changes after brain injury, it is important to address the negative behavior in a constructive way. Encourage the survivor to share his brain injury history with the group. This sharing may include disclosures of some of the behavior changes he has experienced and may prepare other group members for the presence of these behaviors. Provide direct, honest, and polite feedback to the survivor regarding his behaviors. It is also important to realize that sustained prescription medication use is often necessary after brain injury to not only reduce the risk of life-threatening events such as seizures, but to also reduce post-injury problems such as anxiety, irritability, and lack of concentration. Tolerance of medication use for these conditions is important to helping the survivor overcome behavior concerns. In the following clip, notice how the brain injury survivor is unaware of how his interruption impacts the group. The counselor does not ignore the behavior, but encourages the survivor to discuss his behavior with others.
so, how's everybody doing today? Anything interesting going on last night? Anybody go to a meeting or anybody feel like using anything?
Last night was pretty rough. To be honest with you, I actually just went to go get some gas, and in the gas station there was all this beer and there's even wine, and I was dying for a drink. And I actually went inside and thought about buying and sat there for a while. And
I know what you mean, man. It's just, I had that temptation too. Oh,
Okay.
sorry, go ahead. Go ahead.
no, I ended up not, but leaving the gas station, there was my favorite bar, so I stopped in there and Sat in the parking lot for about 20-25 minutes. And
Well, what bar is that? Cause I know I went to a bar a couple of days ago, and it was off the chain for real. It's just crazy. I mean, which
you
one?
quit interrupting me, please? I'm trying to say a story here.
I'm just giving you my point.
I know, but you're interrupting me. I'm trying to